Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. This immunology lecture is a continuation of the immunopathological diseases. We talked previously about hypersensitivity reactions. In this lecture, we are going to talk about autoimmunity and immunodeficiency. We start with autoimmunity. In autoimmunity, the immune system reacts against self-antigens, leading to autoimmune diseases. These diseases are classified into organ-specific, where the autoimmune disease is confined to just an organ. The example is Graves' disease, which is confined to the thyroid gland. The pernicious anemia, pernicious anemia is due to vitamin B12 deficiency, and the deficiency is due to lack of intrinsic factor, which is secreted by the parietal cells. So the lack of intrinsic factor is due to destruction of the parietal cells by the autoimmune disease. We find here the real cause of the pernicious anemia is confined to the stomach, where the parietal cells are destroyed. The second type of autoimmune diseases is non-organ specific. Here, the autoimmune disease affects multiple organs. The best example is SLE, which is systemic lupus erythematosus. Commonly, autoantibodies are detected and they are used for diagnosis. But the mere presence of autoantibodies without demonstration of autoimmune disease does not diagnose the autoimmune disease. So the presence of antibodies has to be coupled with the presence of the autoimmune disease. There are conditions that affect occurrence of autoimmunity. Number one, genetic predisposition. People are genetically different, and some of them may be genetically predisposed to occurrence of autoimmune diseases. Age, also the occurrence of autoimmune diseases varies with age. So older people may have more susceptibility to development of autoimmune diseases, but this type of disease may affect all ages, but some ages are more affected than others. Gender, there are some autoimmune diseases which are common in males, others are common in females. Viral infections, commonly some viral infections are associated with autoimmunity. Chemicals, being drugs or other chemicals, are also associated with occurrence of autoimmune diseases. Cross-reacting antigens. Here the best example is the rheumatic heart disease, where the antibody resulting from the antigenic stimulation by Streptococcus pyogenes, these antibodies cross-react with the antigens of the heart tissue, leading to rheumatic heart disease. Release of antigens of privileged organs. There are organs in the body whose antigens are not tolerated by the immune system. The example is the eye, testicle, central nervous system or the nervous system, and the placenta. If such antigens are exposed to the immune system of the body, they'll be considered as foreign, and it mounts an immune response against them, leading to autoimmune diseases. Here we come to immunodeficiency. It is a lack or deficient immune function. It can be acquired, which is the more common, and can be congenital, which is rare. Uh, in immunodeficiency, there will be increased susceptibility to opportunistic infections, to infections by microorganisms which are not normally causing diseases. The less virulent microorganism and the microorganism of the normal flora. Here we see our example is the oral thrush, which results from Candida albicans, and Candida albicans is part of the normal microbial flora of the body and the oral mucosa. So when the immunity goes down, oral thrush may occur, and the infection and the infective organism will be within the organ here. Number two, rare tumors become common, like Kaposi sarcoma in in AIDS caused by HIV, human immunodeficiency virus. And commonly speaking, the immunodeficient patient is more prone to develop tumors. There are conditions that may lead to immunodeficiency, physiological, and the example extreme of age, people or children who are very young, their immunity is not yet developed, it's growing. The very old, here the immunity wanes out. During pregnancy, this is for a period of pregnancy. The immunity of the pregnant woman goes down so as not to attack the baby in uterus, because half of the baby is foreign. It belongs to the father. Otherwise, the baby will be rejected. Number two, a main cause, malnutrition. So nutrition is very important in development of good immunity. If for a reason or another there is lack of nutrients or inability to utilize them, immunodeficiency may occur. Number three, infections. Infections, this is a common cause of immunodeficiency, like viral infection, HIV infection, bacterial infection like tuberculosis, and parasitic infection like visceral leishmaniasis, which is Calazar. Cancer. We know that cancer attacks and destroys and infiltrates many organs and maybe systems of the body, leading to lower immunity. Hormonal disturbances like diabetes mellitus, diabetic people, or uncontrolled diabetes. The people of uncontrolled diabetes have got low immunity, and also thyroid disturbances and other hormonal disturbances. Radiation will attack the immune cells and destroys them. Chemicals, being drugs as immunosuppressive drugs, corticosteroids, or other chemical for other reasons, also they participate in lowering the immunity. By this, the lecture is over, and I hope that it is understandable, and I wish you all the best.